Good evening, everyone. My name is Brian Massa, and I'm the Director of Global Health Advocacy for the Shot at Life campaign. It's a real pleasure to be with you here this evening during your busy days. I know that many of you are coming home from a busy shift and or in between a shift perhaps, and I'm just really thrilled to be able to speak with you a little bit today about how to raise your voice for global child immunization in the country. We're going to talk a little bit about the state of global child immunization as well. There's been a lot of changes with U.S. government support for global health writ large, and particularly with global child immunization as well. As I mentioned, Brian Massa, I'm the Director of Global Health Advocacy for Shot at Life. And for those who aren't aware of the Shot at Life campaign, it's the country's largest grassroots organization that's dedicated solely to supporting greater U.S. government investment in child immunization programs for developing countries. The federal government has a number of budget lines that are dedicated to child immunization, from polio eradication to measles elimination to Gavi, the Vaccine Alliance, which some of you may be familiar with, as well as for UNICEF. And Shot at Life supports all of these organizations and these funding lines. So again, thank you so much for inviting me here to be here to speak with you, NAPNAP members. I know that you're balancing lots of things from patients to charting, and have a lot on your plate. So I just want to say thank you, and thanks for taking the time to listen now or later. So today I want to cover three things in the next 10 to 15 minutes or so. Where global child immunization funding stands this year, especially what the U.S. is doing around that. Why this matters to kids everywhere, not just here at home, but certainly in developing countries. And the small, doable advocacy actions that you can take right now to actually move the needle. So let's dive in. So what's the picture right now? And I'll tell you a little spoiler that the picture is mixed. Global immunization programs, we know, remain one of the best buys in public health. Vaccines save lives and they save money. It's as simple as that. But we're currently in a moment of real strain. At the US government level, there's been big structural changes that you've probably been aware of. In the mid 2025, around over the spring and summertime, Core USAID, that's the agency that was dedicated to global health and development in developing countries for the US. Functions that used to run many of those programs were shifted into the State Department after the decision to dissolve USAID as an independent agency. The State Department has recently released what's called the America First Global Health Strategy that is trying to refocus how the US government and the Trump administration engages in global health. And the Trump administration has also indicated that they will intend to withdraw from the World Health Organization next February. So why does all this matter? Well, first of all, USAID used to be the principal US channel for global immunization programs, financing vaccines, supporting countries to run vaccination campaigns, and funding community outreach as well in developing countries. Big reorganizations also mean program delays and staff turnover, uncertainty about contracts. And what that means is, worst of all, it translates into gaps in delivery while the policy teams try to reorient themselves, and certainly a massive loss of staffing capacity during this transition from the eliminating USAID into a much, much smaller team that's now tasked with this at the State Department. That kind of pause is deadly when it comes to routine child immunizations. And withdrawing from the World Health Organization also would jeopardize our country's access to global health data and also deprive the world of critical US technical expertise that's stopping outbreaks and saving lives. So let's talk a little bit about some of the kind of big multilateral funds that are out there too, because the things that the U.S. government is reorganizing internally is more on the bilateral side of things. But there's also some big multilateral organizations out there that are contributing to child immunization. And one of those is Gavi, the Vaccine Alliance. You might be familiar with this organization. but it is the central global mechanism that helps low-income countries buy vaccines affordably, and also it also supports the successful operation of the country's immunization campaigns. Um, Essentially, it is a organization that pools country demand from lots of different countries and translates that into dependable supply that vaccine manufacturers can use to develop vaccines at a much reduced price for countries. So it's a win-win situation, and Gavi is really a gold standard out there in terms of global immunization. In recent pledging cycles, which is to say how Gavi sort of funds themselves with donor support across lots of different countries around the world, Gavi has drawn enormous global support, and that's bipartisan support as well. But right now, the U.S. role is a little uncertain. Congress has attempted to fund Gavi for the fiscal year 25 period, and actually was instrumental in removing Gavi from any sort of rescission package that happened over the summer that you might have read about in Congress, where they were canceling funding that they had approved. But Gavi was protected from this. It was a real win for global immunization supporters. Um, Congress and the administration are obviously wrestling with budgets and priorities across the board right now, and I think that's probably the most diplomatic way that I can say that. But this affects hundreds of millions of US dollars in funding for global child immunization. Um, so why point all this out? Basically, any sort of interruption, even a single year's interruption in financing for routine child immunization, whether that's measles or DTP or the pneumococcal bacterial infections or rotavirus that causes diarrhea, or for polio campaigns as well. Those produce outbreaks within months, and I would argue within weeks for the more infectious ones like polio, measles. Excuse me. Um, Polio eradication plans are also stretched because of the funding shortfalls and the program delays. There's a global plan that was meant to conclude earlier that has been extended now to ensure that we actually can eradicate polio and get that over the finish line. But these delays cost lives, and it makes eradication more expensive too, the further that we delay. I want to pivot from sort of these macro structures, the U.S. government funding, the reorganizations, these multilateral institutions. I want to pivot from that to a little bit about sort of what Americans think about global health and particularly immunization, because I think it's a good segue to later talking a little bit about your advocacy and ways that you can raise your voice. So there is some good news, which is that most Americans say we should give foreign aid for certain things, if articulated correctly, and many support investments in health overseas, especially when it's framed in concrete terms like vaccines for children or preventing child deaths. A 2025 Pew survey also showed substantial public support for several kinds of foreign aid, including immunization, when people can see their purpose. It's more tangible when you can paint the picture, and it generates more support. So interestingly, though, there have also been polls that point out support for vaccines that actually cross party lines. A poll in August said that there was a broad agreement, vaccines, and this is a quote, so quote, there was broad agreement that vaccines should continue to be made available at no cost, including 2/3 of voters who voted for President Trump and more than 8 out of 10 swing voters. Respondents also said that they placed their greatest trust in doctors and nurses, which of course is highly relevant here for this discussion when it comes to vaccine information. And it included 76% of Trump voters. And in addition, 73% of Trump voters and 83% of swing voters agreed that vaccines save lives. So it's very interesting when you kind of drill past the rhetoric and some of the media headlines about vaccine hesitancy and about decreasing immunization rates, which is true. But it's interesting when you drill down to that the vast majority of voters who voted for President Trump also support vaccines in a way. So fascinatingly, there was another NBC poll that came out that looked specifically at people who support the Make America Healthy Again movement that is supported by Health and Human Services Secretary RFK. And even the majority of MAHA supporters also supported vaccinating kids. Again, quote, while MAHA parents are more likely than non-MAHA parents to skip or delay a child vaccine, aside including COVID or the flu, 3/4 of MAHA parents said they keep their children up to date on immunization. And I thought that was just fascinating. And it's true that the poll also found that parents who support MAHA are also more likely to express vaccine skeptical attitudes and are far less likely than others to say that it's important for children to be vaccinated against the coronavirus and flu. So those two diseases, they are more likely to say that it's not important to be vaccinated against those. But even then, almost 8 in 10 MAHA parents are confident in the safety of the polio and the measles, mumps, and rubella shots. So my point here is that while vaccine skepticism often gets a lot of news, there's certainly extremely worrying outbreaks happening right now amongst unvaccinated populations. I don't want to downplay that at all, which I'm sure that everybody is much more familiar with than I am. There is actually widespread support for vaccination, even amongst some unlikely suspects and demographics. But there is also this underlying worrying trend where fewer Americans today are saying that child vaccination is, quote, extremely important than in the past. And that is a dip that's happening in the perceived importance, which is part of what makes honest, empathetic local conversations, in other words, the kind that you do every day with your patients, so essential. So a translation of all that is to say the political space for vaccines is not a lost cause. People do care, but that support is not automatic. And that's where clinicians and trusted health professionals come in. So let me now pivot to the third and final part of this conversation and talk a little bit about what you can do. So you already know this better than everyone else. The child vaccine programs prevent range of deadly and debilitating infectious diseases. Globally, vaccines reach communities that have the least access to hospitals and clinics. When funding and programs are cut, kids who would have been immunized miss their shots, and that increases outbreaks, which can cross borders, oftentimes destabilize countries or even regions due to health impact, and ultimately can often be introduced here at home. So in terms of advocacy, you are the most trusted messengers in the room, and I mean nurses, nurse practitioners. If one of your family is worried about vaccines, they will listen to you. And the same is true on the civic side of things. When a pediatric nurse practitioner or a group of them says to our elected officials, our government should fund vaccines and protect kids, voters and lawmakers sit up and pay attention. I know this because I used to work in the Senate for a number of years before I came to the UN Foundation and Shot at Life campaign. I worked in the Senate Health, Education, Labor, and Pensions Committee in the Health Policy Office. So we were ground zero for a lot of the development of health legislation. And by and large, without fail, when nurse practitioners and health clinicians came in to talk to us, we absolutely paid attention. You are the most trusted messengers in the room. And I'll also say that for those of you who haven't started on your congressional advocacy adventure, or maybe never tried calling your congressional offices, the staffers that are tasked with handling a health portfolio for their member, they are often looking to people like you to be the experts in the room. Something that most people don't really know is that these staffers handle health, but staffers who handle health might also happen to handle a range, maybe 5 or 6 other portfolio issues, and they have very little time to dig into the details of a lot of these issues. So they turn to people like you who are steeped in them every day in your jobs to fill them in on the information and help them develop policy. So that's where the Shot at Life campaign can really come in to help you as well. You don't need to be a full-time lobbyist to talk to your congressional office. And very small but well-timed steps from people like you can actually move the needle. So Shot at Life can help you in a number of different ways. And for all of this information, you can go to www.shotatlife.org, and that's Shot at Life spelled out. We have a little @ sign that we use, but you can spell it out when you're doing the URL. So a couple of things that you can do. First of all, Shot at Life is currently in the middle of our signature fall advocacy event. It's a 6-week period where we activate our members, our trained volunteers, for something called Mobilize to Immunize, and we present them with a menu of options that they can use to contact their member of Congress. The most basic part of advocacy is picking up the phone and calling your member. And we provide scripts about how you can talk about these global child immunization programs and ask them to continue to support them. Right now, the government is shut down, and we don't know how long that's going to be, but the congressional offices, for the most part, are still operating. They're still picking up the phone. They're still checking voicemail. They're still checking mail. The most important and fundamental part of their job is still going, which is listening to their constituents like you. So if you go to our website, if you engage in this activation moment, we provide scripts for phone calls. We also have scripts for if you're interested in writing an op-ed for your local paper. That's also a really great way to raise the profile of these issues. And again, it's a really terrific way to get your trusted voice out into the public so that it can be heard by others and convince others as well. There's also a range of activities we do that are a little larger scale. We have our signature moment coming up in February of next year, where we actually bring a number of trusted advocates and trained volunteers to Washington, D.C. to advocate in person. We'll have a really great moment to do deep dives on all of the different kinds of policy activities that we educate our champions about. And then we organize a Hill Day for you to go out and actually talk to your members of Congress. My point is that progress it runs on tiny little acts of care, I think, and of conscience, and that's how advocacy is effective. A nurse who convinces a hesitant patient, or a community health worker that walks door to door to talk to somebody about vaccines, or even a lawmaker who hears a clinician's 2-minute phone call and decides that this needs to be a priority. You do those tiny kinds of acts probably every day in your lives. We're here to help you turn those into ways that you can advocate for your members about these important issues. So if we keep pushing calmly, clearly, collectively, we can make sure that kids get their shots, fewer children die, and the world just stays a little safer for all of your patients. We have more influence than I think we realize that we do, and so now's the time to use it. Thank you, and enjoy the rest of your day, and thank you so much again for the opportunity to speak with you. Bye.